Morning, everybody. I welcome you to our second day of Digital Healthcare 2022. We will be beginning with our sessions shortly. Let me just introduce you about the previous day by giving a brief. So this event is to focus on digital health that has been growing immensely in the recent days with much support from Ayushman Bharat Digital Mission. Digitizing the country's healthcare delivery system is the present and future of healthcare. This event is designed to underline a limitless and still largely untapped power of digital technology in healthcare, particularly in opening new gateways of accountability, accessibility, and affordability. This event will articulate the role of digital technologies in elevating both outcomes and lifestyles to the next level. By leveraging the power of emerging technology, the digital healthcare ecosystem would not only aid patients, but healthcare providers, caregivers, policymakers, technologists, health tech corporations, as well as entrepreneurs of the country. Through this event, we hope to explore further gateways into assessing affordable, adequate healthcare in a seamless and efficient manner, thereby significantly enhancing the ease of living for all. So yesterday, we deliberated on many topics, such as the Ayushman Bharat Digital Mission, medical device innovations, connected health, emergency care, and technology for nursing excellence. Today as well, we have some very exciting topics to discuss throughout the day. We also have the famous actor, Mr. Kunal Kapoor, joining us very shortly for a quick fireside chat. So I request you all to please stay awaited. So let us now begin. A heartiest good morning to one and all. I, Dr. Savri Sawant, on behalf of Voice of Healthcare, welcome you all to the day 2 of VOH 6th International Conference, Digital Healthcare 2022, Tech Enabling the Future of Healthcare, organized by Voice of Healthcare, brought to you by Medical Fair India and powered by Crelio Health. Welcome everybody. Let us now begin the event with our inaugural session. I request these dignitaries to please take place on the stage. I invite Dr. Naveen Nishchal, Chairman of Voice of Healthcare, co-founder Meddo Health, on the stage. I invite Dr. Minnie Bodhanwala, who is the conference co-chair and chief executive officer of Wadia Hospitals, on the stage. We also have Mr. Peter Truswell, who is the Consul General of Australian Consulate-General Mumbai, joining us virtually. Welcome. We also have Mr. Sanjay Jha, who is here with us. He is the governing board member of Voice of Healthcare and co-founder of Collateral Medical Devices, on the stage. Welcome. I now invite Dr. Naveen Nishchal for delivering the welcome address.
Thank you, Dr. Savri. Thank you very much. I once again welcome everyone to the second day of 6th International Conference, Digital Healthcare, Tech Enabling Future of Healthcare. I also welcome our international partner countries, Taiwan, Canada, Germany, Israel, and Australia. I also welcome Australian Consulate-General in Mumbai, Mr. Peter Truswell. Thank you very much for joining us. Yesterday, we had some powerful sessions, and we have enough issues to work on in coming days. We discussed we should focus on community emergencies services, how to address roadblocks of telemedicine, and how should we have voices of nurses in key decision makings in healthcare. We are a country, India is a country of 1.3 billion people, or maybe more. I think we are going to be the most populous country. I don't know whether we are now or maybe a few months later. We have 1.3 doctors per 1,000 population, and WHO says that we need almost 3 times of it. We don't have enough nurses. We have 2 nurses per 1,000 population, and we need at least 4 per 1,000 population nurses to meet the demand. We don't have enough hospital beds. In India, there are 250,000 villages, even more. And I don't think that in every village, there is a doctor to take care of their primary care demand. So we can't create this infrastructure overnight. We can't produce required doctors overnight. We can't, create these nurses overnight. But there is one thing, meanwhile, while we create this infrastructure, while we have all these, manpower, I think technology can bridge the gap to address all these challenges. And technology has transformational potential, and I think it's the future of healthcare. Indian healthcare ecosystem is really working hard on digital innovations. Pandemic has taught us the true value of healthcare. The kind of cooperation amongst different countries we witnessed during the pandemic is simply amazing. A lot of collaboration happened at various levels in the pandemic. While talking about Voice of Healthcare, we are a not-for-profit entity, and we are working towards the challenges of accessibility, affordability, and quality in healthcare. Our mission is to help and support various organizations in India and abroad to collaborate and come up with better solutions to tackle healthcare problems. We at Voice of Healthcare are also aggressively working on few initiatives. Voice of Healthcare Academy, we are training and creating healthcare leaders for tomorrow. We have successfully orchestrated the first accelerated healthcare leadership program in 2019, where we had participants from India, Nepal, Bangladesh, Taiwan, Bhutan, and Belgium. We are also conducting awareness series for patients, where eminent doctors around the world educate them against common illnesses and discuss treatment pathways of complicated cases. We are also conducting a lot of clinical disseminating seminars so that clinicians are aware of current trends, how medical field is working these days. We are also conducting dedicated events like this where we can help healthcare leaders to collaborate and create conducive environment for innovation. So we have many more activities planned in coming months, which we will unveil in due course of time. But till then, we have this one day of the conference with power-packed sessions. So we have to learn from these leaders. To conclude, I'm thankful to all our partners, speakers, delegates, chief guests, guest of honors for being part of this occasion. Thank you very much. Thank you.
Thank you, Dr. Nishchal. Next, I invite Dr. Minnie Bodhanwala, Conference Co-Chair and Chief Executive Officer of Wadia Hospitals, for delivering theme address. Welcome, ma'am.
A very good morning to all of you all. I would like to welcome you to another incredible day of the 6th Voice of Healthcare Digital Healthcare Conference 2022. As we all know, that the COVID pandemic has catalyzed transformation for global economies and industries at an unprecedented speed. We have experienced a decade of change in the span of last 2 years, And if we see as an example, it is the diagnostic center which has been the center of this revolution. In fact, it has been driving the other changes. The pandemic has proved that diagnostic sector carries potential to completely alter the face of disease prevention, detection, and management, and usher a golden era for the healthcare. But some big questions continue to linger. What will the next generation lab look like? How can we master the complexities of global supply chain? What are the technologies, methodologies, leadership we need to create the right kind of future? The answers will surely come shortly, but only when we step forward to ideate, synergize, and collaborate as united force of global transformation. And I think the sixth Voice of Healthcare digital conference brings us this platform to achieve exactly that. And that is what we have seen the whole of yesterday. This unique event is our clarion call to rise, respond, and build the next era of excellence for diagnostics and other parts of the healthcare too, and position India as a global diagnostic super hub. Today, we are fortunate to have with us an exceptional league of idea champions and change makers. Each one of you could be a change maker. Just think over it. The powerful gathering of personalities controls enough power ammunition to rise the game for diagnostics and the change not only in healthcare but in other sectors too. The big question is, can we recognize this opportunity? Today we are all here. So maybe you can go back and brainstorm. Are we ready to seize the day? Yes, I think the tide is rising, time is ticking, and the moment has come to act. So I would request you all to take whatever knowledge you have from this session and to use it. Thank you very much.
Thank you, Dr. Minnie, for such an encouraging message. We have a very special guest today with us, who is the Consul General, Mr. Peter Truswell, who is the Australian Consulate General of Mumbai. He is here with us virtually. I request him to please deliver his special guest address.
Thank you. Thank you so much for that introduction, and thank you also to the other speakers before me. I hope you can hear me loud and clear. Look, firstly, I'd like to extend my thanks to the Voice of Healthcare for having Australia present today as a country partner, and I'm sorry I can't join you in person. It truly is a privilege to be addressing the many healthcare practitioners, businesses, and policymakers on behalf of Australia. Australia, as you know, is one of the most sophisticated and advanced healthcare markets globally. Of course, as you mentioned, Dr. Naveen and Dr. Bodhanwala just a moment ago, since the last Voice of Healthcare International Conference, we've all been very heavily impacted by COVID-19. And that's forced many big changes in both of our healthcare systems. It's shown us that we need to be nimble, we need to look ahead, and we need to be prepared for future healthcare events and risks. And we need to have a dynamic dialogue, I think, about these issues. As viruses and diseases evolve, so must our healthcare systems. And I appreciate particularly the opportunity to talk to you today, because global synergies will be central to us, to enabling us to provide the best solutions in both of our countries, and to help address some of the risks that the speakers before me talked about, the lack of healthcare professionals, particularly in India. Australia's healthcare industry will, I'm sure, be keen to share its expertise in technology and data-based medical interventions to benefit health outcomes in India. And I think there is a lot that we in Australia can learn from India's public health initiatives, in particular, Ayushman Bharat digital mission and India's success in managing COVID-19, which in a way we've seen most particularly here in Mumbai itself. I do believe that digital and technological interventions will determine the future of healthcare. Healthcare infrastructure, medical education, and affordable treatment are and always will be areas of focus for us in Australia. But access to quality healthcare is a major issue. It's a challenge India faces. It's also a challenge that we face in Australia, although we have, in some ways, a more sophisticated healthcare system in terms of certainly the number of healthcare professionals. And digital healthcare. Digital healthcare can play an equalising role through medtech platforms, telemedicine, remote monitoring, and e-pharma. In Australia, we've developed strong expertise in medical devices and niche technologies on the diagnostics and monitoring side, and we're keen to share those where we can and our expertise with India. Many of you may have heard of some of the solutions that we have developed in Australia. They include the cochlear implant or the bionic ear and continuous positive airway pressure devices for sleep apnea. Those innovations have transformed the lives of people around the world, including here in India. Many have benefited greatly from the cochlear ear, which has given them the chance to lead a normal life despite hearing disabilities. Another thing that's important, I think, here is, the size, geographic size of Australia and our relatively small population mean that we've had to be very forward-looking in terms of developing remote care, monitoring, digital therapeutics and diagnostics, and many other e-prescription services and many other tools to tackle our geographic size and the distance between our population centres. I think the Indian, the Indian National Digital Health Mission represents an excellent opportunity for Australian digital health providers to work with you in these areas. And I think there's more we can do in terms of working together on training health professionals. Another area of focus should be pharmaceuticals, pharmaceutical security and supply chain resilience, especially given the strength of India in pharmaceuticals and India's big presence already in the Australian market. One thing I'd like to mention is a recent agreement that was signed in early April by our trade ministers. That's the trade ministers of Australia and India. This is called the India-Australia Economic and Trade Cooperation Agreement. It's effectively an interim FTA, free trade agreement, and indeed the first free trade agreement India has signed with a developed country in around a decade, so quite significant. And this has provided a pathway for mutual recognition of pharmaceutical products between our countries, which I'm sure will help a great deal. Another area where we need to do more and where we are doing a lot, I think already, is in bilateral cooperation between our two countries. And one example there, which I'd like to mention, is in the Quad. So India and Australia work together with the other two countries, Japan and the United States, to develop a Quad vaccine partnership. And that partnership between those four countries, including ourselves and India, is expanding or helping to expand COVID vaccine manufacturing in India to benefit our region, the Indo-Pacific. And it includes support to boost production by at least 1 million doses by the end of 2022. In terms of business interaction, I'd like to just mention one other aspect, which is something called the Australia-India Business Exchange. That's a forum that's developed by the Australian Trade Commission to help businesses in both directions to develop their markets. It's been a big priority for us in the last couple of years, and one of its 5 areas of key focus is healthcare. And indeed, very opposite today's discussion, the 2021 dialogue, of what we call ABEX, the healthcare chapter, was focused very particularly on digital healthcare opportunities in India. And I'd be very happy to connect anybody here today or subsequently with the Australian Trade Commission to see if there's opportunities for us to do more there together. And finally, I should mention the Australian university and tertiary sector, which is really a cutting edge in terms of research medical research, medtech, and things like that. And there are quite a few Australian universities which have developed very strong links, joint courses, joint research with Indian institutions. And I think that's an area where we can do more together, even though much has been done, to develop the research into digital technology and healthcare that will help us achieve some of the goals that the previous speakers mentioned. So look, I won't talk too long. I know I've only got a limited time, but I'm sure that with this wonderful conference, with the areas of focus, with the number of professionals who are coming here together today and yesterday, and working together, in particular Australia and India, we can help achieve some of the objectives that you're so focused on. So thank you so much for letting me speak today. I'm sorry I can't be there in person, and I look forward to hearing also from the other speakers. Thank you.
Thank you, Mr. Truswell. And the famous Indian actor and co-founder of 𝐃𝐃, Mr. Kunal Kapoor, is here with us. We will be having him very shortly. Before that, let us now proceed to the last thank you note from Mr. Sanjay Jha, who is the governing board member, Voice of Healthcare, and co-founder of Collateral Medical Private Limited.
Thank you, Shauri. Thanks, Mr. Peter, Australian Consulate-General, for talking about India's success on managing COVID-19 and talking about Australian companies like Cochlear helping India and brighter trading days ahead, especially in the digital healthcare system. Thank you, Dr. Minnie Bodhanwala, conference co-chair and CEO Wadia Hospital, for calling upon all of us to be the real change makers. Thank you for that. Thank you, all of our partners, amazing delegates, wonderful speakers, and all the organizers, because without this, it would not have been possible. And last but not the least, thank you, Dr. Naveen Nishchal, Chairman VOH and co-founder Meddo, and entire VOH team for putting together this amazing conference. Thanks, everybody.
Thank you, Mr. Jha. Now I request Dr. Neha Sashotra to felicitate Mr. Sanjay Jha. I request Mr. Rajiv Nath to please felicitate Mr. Minnie Bodhanwala. Thank you very much.